In this morning's Health Watch, asthma and acetaminophen. A new study argues that adolescents who take the popular pain reliever, best known as Tylenol, even once a month, could be more at risk, even double their risk, of developing asthma. Dr. Holly Phillips is here with the story. Good morning. Good to see you.
Good morning, Harry.
Tell me about this study.
Basically, this was a large study. It looked at more than 300,000 kids, specifically 13 and 14-year-olds. And what the researchers found was that kids who took acetaminophen at least one time per month had more than double the risk of developing asthma later in life. So it was really significant findings. And acetaminophen was also linked with eczema and nasal congestion as well. So it wasn't just the asthma.
Now, could it be that because the kids were taking it, that may just be because they have other symptoms and they were trying to use that to help it along? Or do they think that the use of it is actually exacerbating?
Right. Well, that's a good point, Harry. This study actually couldn't point out a cause and effect. They couldn't say acetaminophen caused these symptoms, but they're leaning toward that. But right now, we need more research to be able to say it definitely causes these things.
If you've got a kid or you've got especially a teenager and a child uses it from time to time, should you stop?
It's certainly too soon to change those recommendations. Basically, 1 in 20 kids will get asthma. So it's probably a combination of factors that are contributing to it, not just the acetaminophen. But that having been said, if your child has asthma or frequent respiratory infections, nasal congestion, it's worth talking to your pediatrician about it, because some kids are more sensitive to drugs than others.
Yeah, very interesting stuff. All right, let's just talk then about asthma itself and things you can do in your household to lower the risk level.
Well, the number one risk for asthma really is family history. We know there's a huge genetic component to asthma. So if your parents have it, you are in fact more likely to get it. Allergies also play a role. People who have hay fever or even multiple food allergies are more likely to have asthma. But things we can really control are our environment.
Big time.
Exactly. We know pollution is linked with asthma. And most importantly, smoke. Secondhand smoke around children has been proven to greatly increase their risk of asthma. So don't smoke, and definitely don't smoke around your kids.
Take them outside.
Absolutely.
There you go. Dr. Holly Phillips, thank you very much.
Sure.